Hello, my name is Dr. Yosef Hamati with Orthopaedic Associates of Muskegon. Today, I'd like to talk to you about spine problems. First of all, Orthopaedic Associates of Muskegon have well-trained, fellowship-trained spine specialists. There are 3 surgeons as well as 3 physiatrists who deal with spine problems on a daily basis. The most common problem we see is really herniated discs and spinal canal stenosis or narrowing, and occasionally we see infection in the spine and tumors of the spine. In general, the most common problem we see as we age is spinal canal stenosis. This could happen in your cervical spine. Cervical spine is the top part of your spine. It could happen in the thoracic spine or in the lumbar spine. In the cervical spine, we call it the quiet disease. You all of a sudden will start almost staggering, and some people come in with radicular pain where you will have pain in your shoulder right to the arm. And what happened, the space available for the spinal cord gets narrowed, and that's called spinal canal stenosis. Or where the holes where the nerves come out, they could also get tight, and we call that foraminal stenosis. Foramen means a hole, and where the nerves come out, then your arms start getting numb, tingly, heavy. But it's a very common problem. I bet you the 3 of us, the surgeons in OAM, do at least 500 to 600 cervical spine cases a year due to these problems. But really, the most common place for it is the lower part of the back, which is called the lumbar spine. In the lumbar spine, we have 5 lumbar vertebrae, and the canals is a little bit wider than the cervical spine. But because most of our weight, especially if you're a little heavy on the belly like me, will go through the cervical with the lumbar spine and cause a lot of symptoms. Usually the patient come and say, I cannot walk. The most I can walk is 100 feet, then I have to sit. If I sit for 4 or 5 minutes, I can get up and walk again. If I do my dishes, I cannot do them all in one stage. I have to divide it to 3 stages. So these people, quality of life start changing. Some of them also develop what we call radicular pain. It affects the patient life. It affects your quality of life. Because in America, we are very independent people, and we live to be 90, and we are still independent. So this is something which affects our quality of life. In general, we like not to do surgery right away. We only do surgery when it's affecting your life pretty bad, when your function is curtailed and you are unable to do what you want to do on a daily basis. And if you have a lot of pain and it's affecting you on a daily basis and you have to take pain medications, which is now with the narcotic problem is very hard to get and use. Surgical options are many. In general, we do surgery when the patients do not respond to the physiatrist treatment or our treatments of injection or medication or anti-inflammatory medication. But we are always available for you. If you have any spine problem, I'd like you to schedule an appointment online or call us, please, at 231-733-1326.